Welcome to another episode of the Wellness Chronicles. I'm Stacey Dyce, and today's episode is called Clicks versus Care, Finding Truth in HIV Prevention. We live in an information age where every answer is supposedly just a click away. We use the internet to find restaurants, book flights, and look up symptoms. But when it comes to something as vital, as personal, and as life-changing as HIV prevention, diagnosis, and treatment, the internet can quickly become a dangerous source of confusion, fear, and flat-out lies. Today, I want to talk about the power of knowledge and why choosing to seek that knowledge from qualified healthcare professionals and a reputable science-backed resources are the most important decisions you can make for your sexual health. When you search HIV symptoms at 2 o'clock in the morning, the results often fuel anxiety and promote harmful misinformation that was debunked decades ago. You might read about a miracle cure or a detox diet that promises to defeat the virus. That is false. You might encounter old stigmatizing myths that falsely claim that HIV is a death sentence, or that it's spread through casual contact like sharing a toilet seat. That is false. The risk of falling for this unverified content is profound. It leads to self-diagnosis, delayed care, and preventable suffering from all things we don't need. Delaying testing or stopping prescribed medication to try a random online remedy is a critical error that allows the virus to progress, damages your immune system, and puts your partners and you at risk. Instead of relying on algorithms, we must rely on expertise. One of the most crucial resources for HIV prevention and diagnosis is a qualified healthcare professional. Why? Because modern HIV prevention and treatment are personalized, complex, and highly effective, but only when managed correctly. We offer accurate diagnosis. We use up-to-date screening and confirmatory tests that you cannot replicate at home. We offer tailored prevention. For example, we assess your individual risk, lifestyle, and history to determine if PrEP, pre-exposure prophylaxis, is right for you. PrEP is 99% effective when taken as prescribed, but it requires a prescription and regular monitoring. We offer life-saving treatment. If you test positive for HIV, we immediately connect you to antiretroviral therapy, or ART. ART is so effective, it can suppress the virus to an undetectable, or U equals U, undetectable versus untransmissible level, allowing you to live a long, healthy life with virtually no risk of sexual transmission. You can't customize a treatment plan, access PrEP, or understand the life-changing power of U equals U from an anonymous forum online. You get that through honest, confidential partnership with your doctor, nurse, or a specialized counselor. Beyond your clinical provider, there are excellent, reputable sources you can turn to for reliable information. Look for organizations and websites that end in .gov or are backed by established public health bodies. HIV.gov, the official U.S. government gateway for all federal HIV information, the CDC's Let's Stop HIV Together campaign, they provide clear, factual public health data and combat stigma. National Institutes of Health, the NIH, clinicalinformation.hiv.gov for the most current evidence-based treatment guidelines used by doctors across the country. These sites are committed to science, providing information that empowers you to take control of your health. So let's leave the myths and fears to the outdated corners of the internet. Your sexual health, your entire health, is too important to risk on an unverified search result. So make a commitment today. 1. Trust that your healthcare provider is your most trusted source of truth. 2. Recognize the dangers of self-diagnosing and unverified information. And 3. Use reliable, science-backed resources for all of your questions about prevention and care. Be proactive. Be informed and choose science over stigma.